Let's table this idea of how happy people might be to give the data for 1 second, because what you said made me think of something related to just measuring how healthy people are. Right, so typically we do that during an encounter. There's a healthcare professional with a patient, but actually as I'm thinking about Peter's business, there's a huge amount of behavioral information about people, where if we could gain their trust, if we could tie that to the information that their healthcare professionals had, maybe we really could create value outcomes in a much more significant way than just what healthcare professionals alone could do.
So look, trust is the core issue. It is the core issue. We don't share medical information in America. We don't share it anywhere in the world meaningfully. We just don't do it. I was on a presidential panel for 3 years, 10 years ago, and we decided that if only healthcare could do with data what finance does with data, same people, right? If only we could get that level of information technology work going on, only 3 things would happen. We'd have dramatic reductions of cost of healthcare, we'd have dramatic improvements of quality of care, and we'd have an entirely new kind of science. But other than that, it probably wouldn't be worth doing. Right? So what is the core impediment? It's Verizon's job, as we see it. Obviously, we've got communications working. We've got strong, powerful devices on everybody's hip. So it isn't an issue of compute power or communication. That's just not the problem. The problem is trust. And so we see it as a big piece of our problem to remove those barriers from the industry, to make it so that we can provide the industry strong ecosystem of trust. We've got an identity management system that operates in most of the world that does the identity cards for 100 million people just in Europe. But if we can figure out, and we've published such a system lately, if we can figure out how to not only know who it is you're really talking to and who really gets the data, and those systems are both in place now, but also the attributes of those people. I am a doctor and my license is in California. Those are attributes. And I could operate on the attributes, not just the person. I can not only inform identity, who this really is, but we can also inform the attributes. So I can inform anonymity. I can make it possible for people to have strong anonymity in the same place. And as these things come online, the majority of this is working now, we think we can make trust be a new kind of ecosystem.
So, Andy, now you've got your microphone. I mean, you're in the crucible of the trust relationship and how all this relates to healthcare data. I mean, do you have a similar view?
So I'm even more powerful when you can hear me. The thing that I wish I could say that data or technology, when that gets better, that's gonna solve the problem. I actually think on the ground in the real world, it's all about culture. And organizations that have a culture of safety, of improvement, of quality, they tend to be able to get data. They tend to, whatever data they get, they tend to be able to explore it and use it, make it better. And we have, you can always look at data and say you don't either trust it because it's latent, you don't trust it because it doesn't apply to you, and so on and so forth. But the leaders of delivery systems, particularly in organizations that have a culture that's focused on an outcome that you need data to get at, have been incredibly successful, or I should say much more successful in making this work. Because for all the rest of us, because we don't have access to data, we actually stop asking data-driven questions. And so healthcare has become a game of playing hunches. And moving beyond that, I think, really has to happen at that level in the delivery system.
So the word culture is interesting, right? So we're talking about better outcomes and cost savings, but an inherent part of the culture of almost any organization that has a competitive landscape that they work in is that you want to win, right? I'm sure, Peter, you must be using big data to create competitive advantage.
Sure.
At Verizon. Right? Is there an inherent ethical issue that we need to think about?
To me, the key, we call this shared success, right? What we want to do is make it so that we empower the whole industry to raise all boats, but at the same time, get a little bit more of the pie than the other guy. But that's shared success in raising all boats.
But, I mean, the principal, now you're talking about the general incentives and cultures, but the principal problem in healthcare is there isn't really good competition, and quality is an externality. I mean, if you can cut on quality, it's usually invisible. I mean, it's only our professional obligation that we feel there's a need for us to provide the very best quality care. But you can save money by cutting corners on quality, and you can just pay attention to your finances. And on a hospital, your bottom line will look good, and you can present to your board in ways that they'll feel that the hospital's healthy and providing jobs. But for the patients, you're not getting what you need, and it's up to us, I think, to create an impetus of. I mean, we still lack the killer app that's going to show people, and organize the data in ways that are meaningful.
That's not what happened in the auto industry. The auto industry won the market. Japan took it over because of quality.
Yeah, but they're not taking over New York Presbyterian. I mean, the issue is going to be that I think we need a greater degree of transparency around health indices in the same way that we do for the financials. And then that has to be both the professionalism to set in, but it's going to be having us settle on what data are meaningful. I mean, within the boardrooms and within the executive suites of hospitals all over, they have questions. The natural culture is evidence-based, but whether or not they're able to grab the information that they need, it's put to them in a way that they can make change and it moves the system forward is not there. Plus, I mean, the big data vision is that we can really understand these patterns and reduce the variation. And then you guys don't have to search for the very best doctor like you don't search for the very best pilot when you take a flight. But you can understand that the level of performance is uniform. The top 10% or 5% of doctors can't take care of 100% of the patients. So how do we elevate the entire system so everyone can feel confident, but those indices are there and transparent and reported, and people can understand what they're going to get? And then at the transactional side, how are we using this with Q theory, for example? Where are we using all the data that's coming in from the emergency department? So why should it be that you don't know when you go in if you're going to wait 4 hours or 2 hours? Why don't we have surge capacity figured out? I mean, why don't we provide the services that people need in ways that we can use the data so the transactions work smoothly?
So let me ask this. And you can react to this, Andy. I know one of the things that Steve would say is, you have this unhealthy, unnatural economy when a patient is going to get care because they don't know what it's going to cost, right? That means that the rules that we all learned in microeconomics.
And they don't know what results, they don't even know what results are being achieved, yeah.
So is big data, is this a way that we can create a more healthy economy around healthcare to try to fix some of those problems? The information transparency, do we hold a key to?
In part, I mean, there's nobody in this room that's been in healthcare for any length of time that thinks that there's a silver bullet. There just isn't. There's a lot of things that have to work. And I think your question is the right question, Glenn, because there is, by definition, no big data if there's no collaboration. If you can't link what happens to a patient outside of the care setting, you have no idea what's going on with their health, and you can't make reasonable judgments. And if you can't go deeply into and link areas of healthcare, the data is a lot less valuable. So we have this sort of parochial system of healthcare where we all feel like we're in constant competition with one another. And at a local level, that competition is going to be fierce. There's too many beds, there's too many medicines, there's too many of the kind of stacked up kind of similar variety. There's all kinds of capacity that's going to chase memberships and patients and so forth, and that'll be fairly intense. But nationally, there is I think a foundation of knowledge that actually should be built and can be built.
How do we build that?
Well, I think you're going to see some things. I don't think it exists today. I'll be honest with you. I think you're going to see some things over probably the next 6 months that are going to begin to make a dent in that. But it's got to take everybody's participation. People have to put that aside.
And ask who needs to be at that table? Who is at that table?
Well, look, I can't speak for anyone except ourselves. I'll tell you that if we sit around with an attitude that we have a tremendous amount of data, and we do, we've got 100 million patient lives over 17 years, it's tremendous longitudinal data. It's a drop in the bucket.
Utilization data.
It's mostly administrative.
Drug and utilization.
Drug and utilization data. Exactly. That's exactly the point. If we use that data to try to solve problems that it shouldn't solve, we're doing everybody a disservice. But if we use that data to attract other data, to attract genome data, to attract other types of data that can be linked with, then we're actually going to move the ball forward.